to introduce today's webinar. As we talked last meeting in Brussels, and you already know it, Dr. Wemberg, the European Commission has launched a set of European Reference Network core indicators. So we had I have planned for today just to take a look at those indicators.
Yes.
Just also to check out which indicators are those and how do they fit what we have been working on in our working group and what we have to undertake as a network. And well, as the previous webinar, well, we can just present ourselves. So if anyone else takes a look at the webinar, they can know who are speaking at this webinar. So as well, I can introduce myself. I am Dr. Jose Ojeda from Hospital La Paz in Madrid, in charge of this working group from the coordination of the ERN.
And my name is Lars Wennberg, and I'm the technical director of the working group, and I'm a transplant surgeon, and I work in Stockholm at the Karolinska Hospital.
Perfect. So if anyone else is joining the meeting afterwards, they can also introduce themselves. So as we have been saying in the last meetings, the European Reference Network legal framework defined that the process of putting or launching the networks will also include the assessment, the approval, and the evaluation of the networks. So once that we saw it last November in Brussels, this February it will be 2 years in the functioning of the network. So this is the right moment. The European Commission believes is the right moment to push forward the evaluation of the networks. So as we have said other times, this system is being identified by the European Commission with the help not only from the ERNs coordinators that are participating in the groups that are being taken by the European Commission, but also this continuous monitoring and assessment group has participation from the member states, because we have to keep in mind that this is not only a responsibility of the hospitals, of the healthcare providers, or the ERN coordinators, but of the member states and the European Commission in a whole group. Okay. So, as I said, we have already, it was presented in Brussels last November, a set of 18 core indicators that, well, we will take a look at it at this webinar.
Okay.
You will probably recognize this slide. I took it from the presentations that were made in Brussels last November. As we know, European reference networks were launched in March 2016. There was an initial assessment and approval, and now it has been proposed as planned that the continuous monitoring and assessment will take place from now on, including the data from 2018, 2019, and 2020. So the aim is to have a final evaluation when this project was planned, that is after 5 years of functioning of the networks. So at that point, that's what the European Commission has told us. We will, I mean, there will be a decision will be taken to the member states to decide whether the European reference networks will continue or they will be terminated. I don't know if you want to add something about this because you were in the meeting in Brussels.
No, I think, I mean, this was very clear that there was no free rides here. That we
Yep.
are supposed to fulfill our goals and fulfill the evaluation. And if we do successfully, however, there were great expectations and hopes that we could have a continuation of the ERN network activities.
Of course. I also believe that, of course, as we have to have an evaluation plan. The goal is 5 years, but of course, a lot of stakeholders, not only the healthcare providers from the European Union, are expecting that this project doesn't terminate at this period of time. But we have to have very present that what we will push forward these 3 years that will remain will be critical in order to evaluate what the networks have achieved. Yeah, I agree. So only to give a glance of what the roadmap of this process of monitoring and evaluation that has been planned by the European Commission. The first work package is this group of 18 core indicators that will be common to all ERNs, and that's very clear. We will have to have them. We have to have them in mind. We can push forward our own indicators, but we have to have these ones into our scope. Yeah. It's not now on the agenda, but we have to have in mind that there will be another 3 working packages during these 3 years. The second one will work on the specific set of indicators that every ERN has been working on in these first 2 years. And for example, in our case, we have been working in the first 2 years in specific transplantation outcomes. Yes. And indicators. So that will be the moment. Of course, we won't stop working on those indicators and getting the data as approved in the survey that we have prepared. But I want to explain better. We have to focus on the core indicators, but there will be a step ahead. I mean, there will be a step forward when finish this first work package. When we will try to push to put into the European Commission our experience in our indicators. So we will still have time to finish the survey, to get our data on transplantation, and to use it for this second working package. There will be a third working package. As said in the slide, it will be extended set of indicators. This is in relation to the original application forms that all the healthcare providers had to fill at the beginning in the 2016. And of course, it is planned to have a fourth working package. That it is meant to be external validation. It is not yet defined whether that validation will be undertaken by the member states, by the different bodies or agencies that different states have in order to validate the functioning on the networks, or it will be a third party. As for example, when the networks were launched, there was an agency that was contracted by the European Commission in order to do the initial evaluation, the initial launching.
Do you think that the indicators in the third and fourth packages will be the same, or are they different?
We don't have yet very much information about that. I guess that in the third package, what it is intended is in order to those information that was filled in the application form to transform it into indicators or something that we can monitor continuously. But they haven't. I mean, there's a document, but there's not much explanation yet on that. And in the fourth package, there's no information yet. No. I guess that yeah.
Who will be the responsible party in the third working package? Is it the ERNs or is it the European Union that will set up this?
It's the European Union. It's in this group that I have been talking about that is conducted by the European Commission.
Yes.
But there's a participation from some of the ERN coordinators in this group, and there's also participation of some of the member states. So.
Yes.
What the European Commission plans to do is to, after finishing this first package, that is going to be, expected to be filled in this beginning of the year. They will, they are already asking for a specific set of indicators that the different networks have in place. So I guess that maybe at the second half of this year, they will start to work on the extended set of indicators.
Yes.
I guess that it doesn't have to. It cannot take much time to undertake these two working packages because, as I said, there's when we get to March, there will be only 3 years to push this plan monitoring. So I hope that this information will get soon, and we will have the chance to work it in our working group and in our networks. So that's the general idea. But I'm afraid I don't have more information here. Sorry.
We will see.
So that's the overall roadmap, and this is the plan roadmap from the first working package. As you can see in the slide, they have been already been presented in the November conference, and now as we will see in the following slide, we are expected to start short reports or monitoring reports periodically, and it will continue in the following years, and they will ask this fulfillment of the core set of indicators every year, not only every 3 months. That is the idea that I will present in the next slides.
Okay, and this will be done by the coordinating center or by each member center?
We will get into that because the core set of indicators will be the information will be taken from different data systems.
Okay.
So we can see it in the next slide. As you can see here, they have identified at least 5 sources of data. The first one that, I guess that all the members by now of the network will already know about that, is the Clinical Patient Management System, or the so-called CPMS. In that source of data, we will have not only the cases that will be and that are being launched, or that are being sent to consultants to have virtual consultation, but only this tool will track the time of the answers, how the information gets back to the physician, asking for the consultation, and all this information. Some of this information will feed these indicators that we will be presenting following. Of course, another source of data that we have to take into account is the specific records and databases that the different hospitals and healthcare providers have for the administrative functioning and management of those patients, not only the clinical management but also the administrative management. Of course, there can be, and we still have a way ahead in order to identify other records that our different healthcare providers are using. That's another possible source of data. There's another source of data that we are already producing, although we haven't launched our quality and safety survey, but we already have some records that we have been gathering at the ERN Coordination Center at Hospital La Paz that we have asked you, the healthcare providers, to provide us. And finally, but not less important, is those records that are in possession of the European Commission and that this system is planning to use in all the expected working packages. So those are the possible sources of data, and the idea is to see in the following two slides which indicators are planned and which ones are going to be extracted from one source of data and from another. So we can have an idea on how we are going to achieve that in our network. So I don't know if it's clear, Dr. Wember. Yeah, no, more or less.
Yes, well, there are several different data sources.
Of course, of course. So this is, well, as I said, there are 18 ERN indicators that two of them are not, they are not already specified. One of them is related to the satisfaction of to patient satisfaction, but there's still some work to be done at the European Commission level in order to identify in the way of we are making the virtual consultations in the network, how can we take that information, that patient safety, patient satisfaction information for the patient that is not already settled. So that indicator is out of those 18. And the other one is about how our healthcare providers are getting the compliance on the different protocols or guidelines that are expected to be into place in the different networks. And that is another indicator that is not already in place. So we are talking in this moment, we are talking only in about 16 indicators. And as you can see, 9 of them are the ones that are written in the slide. We will read them now. 9 of them are expected to be taken from the ERN coordination level and the CPMS. The first one is well, it's administrative data. The number and percentage of member states with full healthcare providers as members. Also, the number of healthcare providers represented in every network. The number of affiliated partners that are being launched now by the European Commission and the member states, and also the number of patient organizations represented in the different networks meetings. Those 4 indicators will be collected from the data that the ERN Coordination Center has already in place, so it won't be very difficult to collect them.
No.
There's another indicator that will be, another 2 indicators, the 2.2 and 3.1, that will be taken from the CPMS. That one is the number of patients entered in the CPMS. We already have some information, and with that information, we are working from the ERN Coordination Center with the healthcare providers in order to improve and to help the different hospitals in the networks to get patients into the CPMS, and also not only to have the patients into the virtual consultation system, but also to give an answer from the different panels to that clinical problem, and well, that's something that also will be taken from the CPMS. As you can see, the following indicator, that is the delay to provide multidisciplinary clinical advice from the referral to the clinical advice provided by the network. That's also another indicator that will be taken from the CPMS. So the first 4 indicators will be taken from the ERN coordination level. The next three will be taken from the CPMS, and the other 2 at the end we believe at this point of time that we want, that we have enough information at the coordination level to provide that information. One of them is the number of new clinical practice guidelines. It's not included other protocols on other guidelines that our healthcare providers have already in place, but the ones that are made new according to the launch of every network, and also the number of individual website hits. So those two, as I mentioned, I think that we will be able to collect it from the ERN coordination center. So we move forward to the other 7 indicators that I'm interested to see if we can get some data from the healthcare providers, because in some of them we have information at the coordination center, but maybe we can just think about it in what we have left in this webinar. The first one, I will read it, is the total number of new patients referred to the healthcare provider with disease. In our case, we are talking about transplantation. And in this case, and I don't know if you agree with me, Dr. Wember, we already have in place two indicators in our survey.
Yeah.
One of them was the transplantation activity,
Yes.
and the one was related to the activity that our hospitals do when they follow up patients in the outpatients department.
Yes.
But we have been thinking that maybe it's also interesting to collect the information about the patients that are introduced in the waiting list. I try to explain it better. As our network has a cross-cutting approach on transplantation, and it's not focused on a specific disease,
No.
Maybe we can modify our survey and try to collect information from our healthcare providers in what is in the activity that our centers do when the patient is evaluated for transplantation.
Yes.
We think that can be also something very important to have data on, because of
I
course,
agree with you, because it's a lot of work to
of
evaluate
course,
patients, and not everyone is transplanted, so it's
that's what we were thinking. So as we will see at the end of the presentation, that we're supposed to add something new to the survey we have already planned. Because if we are going to ask to undertake the effort to collect this information, why not ask also our colleagues about if they are able to collect the number, the total, it will be the total number of patients introduced in the waiting list. It won't be the number of patients left in the waiting list at the end of the year. I don't know if I have explained it correctly.
I think you're right, but maybe it's also important to have, you have to have the number of patients that you evaluate.
Mm-hmm.
You also have to have the number of patients maybe on the waiting list and the number of patients that you transplant. There are 3 different sort of figures
I agree.
that
Mm-hmm.
all are important.
Mm-hmm. So we can also think about that. So as you mentioned, it will be patients evaluated before transplantation, no?
Yes.
Okay. It will be also patients in waiting list at the end of the year.
Yes, or accepted to the waiting list, or on the waiting list. That can be discussed. Which figure that is best.
Okay, we can discuss that. Okay, because maybe it's not the same evaluating the patient and putting it into the waiting list. No,
there is a pyramid. You evaluate a number of patients, and then some of them get accepted to the waiting list, and some of them get transplanted. So, and the numbers are going down, in the top of the pyramid. So there are 3 different levels here.
So evaluation, waiting list, and transplantation,
Yes.
And afterwards it will be just the follow-up, no?
Yes.
Okay. So that's something that I think it's very important, because if the other networks will work on collect information on the new patients, we have to focus on what does it mean, new patients for Transplantchild. So
Yeah.
I agree that's very interesting. Yep.
I think it's a good idea because if you just look at the transplantations, then we miss a large part of what the work we do.
Okay.
And I think it also involves the other networks, in fact, to a certain extent, and the other members of our networks, the pediatricians. So it's very good to have them with us.
Perfect. So that will be a first indicator that we will work on that, and of course we have, and you also know, Dr. Wember, that we have worked with the national entities that register the transplantations, and we already have a lot of information about that at national level. But we have to have a broad scope about transplantation, and that's I think a very interesting change that we will try to put into the survey, so it will be finally launched. So that's great. The following one, it's now, I think, that is not so complex, but it's also very interesting. The European Commission is asking to collect information on the webinars that are delivered by the networks. We already have some webinars, and this is an example of a webinar at the end, but maybe there are also activities that the different healthcare providers are organizing or are taking place, are taking forward about transplantation. So we're also thinking about asking our healthcare providers to take this data, because that also will give extra value to the network. So,
and I think one very effective way to do this, I think myself, is that we all working with transplantation and children in this way. We perform, we give lectures on a regular basis in different forums, and I think it's very easy to just sit down and record these lectures and give them as an educational webinar in this way.
Of course, in case that any healthcare provider doesn't know how to do it, doesn't know, of course they will know how to do it, but if they need experience for others, yes.
We discussed this during the CPMS educational effort with your colleagues, that we could just, if we have a lecture, myself, for example, I have given lectures on international meetings on BK virus, and then I just record them and put them on the webinar, and everybody can see them. So I think there's a lot of lectures and knowledge and expertise lying around in the different centers that could be sort of recorded in this way and then given as educational webinars.
So we have extra value for the whole network. That's great. So that's, as I said, something that, of course, as I say in the slide, that is data from healthcare provider level, but of course we will, in these indicators, we will try to build in the data that we already have in the coordination center, but we will ask our colleagues to also have the opportunity to give us some extra information so we can fully fill it.
I think all the participating centers in our network in some way can contribute to giving educational webinars. I think so.
So the idea is very similar, as you can see in the following indicator, that is center in formal education activities. In this case, our network is interested in the, I think I can say it right, in the European credits at European level, but we haven't get it yet. So the idea in this case is that if any hospital from the network is organizing educational activities that have national accreditation at national level, I think that will be enough. So in this case, it's again the same. We already have some information on the data that the different hospitals have provided to us as coordination center, but it will be also a very good opportunity to ask for these formal education activities in case.
Which time period will this be? Will it be since the networks were formed in 2000?
We will discuss that, because as we have already planned a time period for the survey for giving data for the survey. We can discuss about that. In fact, we will see that the European Commission is asking for information in the first 2 years, so 2017 and 2018.
Yes.
So that can be the idea. But of course, if we can think about that more, so it doesn't get so very complex. So
No. I think it's the best to take the same time period as the network has existed. I think it's a good idea.
that's a good idea. Well, as you can see, the following indicator is based on clinical trials or observational prospective studies. As you know, as a network, we are putting forward the possibility of launching clinical trials and observational studies about transplantation. Specifically, this indicator will count if there's one healthcare provider from more than one member state. So it has to be collaborational, at least two. And in this case, again, apart from the data that we can already have, perhaps we can ask in case, although it has been discussed in other groups, in other working groups, like for example the research group. Perhaps there's some information that we don't know, and it can be interested.
There might be other activities going on that is not sort of specific for the ERN, but that involves members of the ERN.
Of course, that's the possibility, yeah. So that's the next indicator, and the other one, it's about accepted peer-reviewed publications in scientific journals. In this case, the recommendation that we were thinking about proposing is that because as we have been discussing in our network in about publication policy, I mean the way about how we reference the network in case we make a publication. The idea was that we can count which publications are mentioning the network. So we would have the possibility to detect those publications and also to ask our healthcare providers if there's something going on. Of course, some of the indicators and the European Commission knows about that. Doesn't have to be now, I mean, it can be now 0. I mean, the idea, as we mentioned before, is that when we finish the 5-year evaluation period, we have to have some results on them. So we still have time to get this.
Important to get this data, and I think it's enough that and I think it's a good idea to set a standard formulation or way to credit the ERN when you do publications, so that everybody does in the same way.
So that's the indicator 5.2, and we go to the indicator 6.1. As we mentioned before, the network, I mean, the European Commission wants different networks to promote a new clinical practice guidelines, but there are already some networks that have already adopted previous clinical practice guidelines within the scope of every network. So we have also to focus this for our network, and when we still have time to ask for the information and to get data. If not this year, the following years, in order to get this indicator forward. No?
One additional thing that you could sort of survey for is the participation from our network in the forming of guidelines within other networks, because the networks for rare kidney and rare liver diseases, for example, they also have guidelines for transplantation, and often it's with the participation from our network.
That's right.
Myself, I'm participating in the rare kidney disease network and writing guidelines. So I think maybe you could also ask for that.
Okay, so it's not only about clinical practice guidelines within the scope of our network, but it can be about transplantation in other networks.
Yes, if it's about pediatric transplantation guidelines in other networks, and that and if we are participating, informing them, maybe we could sort of also give that information.
Perfect. And finally, the last indicator of this group is the number of congresses, conferences, or meetings at which our results as a network are being presented. We already have registered some of them in the coordinator center, but we think that maybe healthcare providers are also presenting the results of the network or some of the activities of them. So that's also the idea. So as I said at the beginning, in these 7 indicators, maybe this is a very good chance to change or to improve the survey we have planned in order to get that data for this first evaluation from the European Commission. So just to see this is the following steps that the European Commission told us last December. There is an IT system that has been developed by the European Commission in order to put this data in. It is expected this IT system to talk to the CPMS, so we won't have to do it manually. But it's also designed so as we saw before, other sources of data are available. Let's see if we don't have to do it manually. But well, this is the original idea. This first IT system for the collection of the information of the indicators is already developed and is going to go live in this month, in January 2019. The idea is in January and February of this year to collect data to the years 2017 and 18, and from April 2009 to collect information on the first quarter or the first trimester of 2019. So this is not yet closed, but the idea is that we to not wait. I mean, the idea is that you don't wait till the end of the year to see if you are getting the results that you were expecting, or if you. I mean, the idea is that you can know in advance that some of those indicators are not going as good as they should be in advance. No, so that's the idea, and that's something they propose about from 2019 and forward to collect the data in shorter periods of time. I mean, not in an annual basis.
Because I think some of these indicators, I think maybe sometimes you need to sort of give extra incentive and information to the network to improve on certain indicators. So I think that's important.
Perfect. So, they announced us that there's an informative webinar taking place this month. We don't know yet when it will take place, but this is the webinar that the European Commission is using to let not only the ERN coordinators, but also the ERN project managers and the people that we have in the IT help desk, and that you already know, and that you have already met. Well, there will be a webinar. We hope that it will be soon, and we will attend that webinar in order to use this IT system and in order to put the data that we will expect to have by the end of February. So this is the last slide that I have prepared. As you already know, we have planned a survey in the last board in our working group. We decided to make it shorter in order to make it easier to fill it up for our colleagues. But the proposal will be to add some extra things to this survey in order to also collect at the same time the extra information that the European Commission is now asking of us. So as you can see, we didn't plan in advance the number of transplantation procedures for the year 2018, and the idea is to take that information too. Also, about the patients attended in the follow-up clinics. But also, as we mentioned before, and maybe we have to write it in another way.
This is good that the total numbers of patients added to the waiting list in a certain period of time, but also the number of patients evaluated for transplant at one network.
Yeah, we will ask for at least in the first two indicators we had data when the healthcare providers we filled the application forms. We had data from 2015, so the idea was to have 2016, 17, and 19.
Yes.
But as this extra information that we are adding now, we didn't have that. We didn't have before. Maybe the information about patients included in transplantation waiting list and the patients evaluated for transplantation, we can keep to 2017 and 2018. That will be easier, I guess. Perfect. So that's the idea. And well, you see that the survey will continue the same. And maybe if you agree, we can also put in this survey some of the previous information of those indicators that if any of our colleagues have some extra information, we can also add the ones that we talked in the previous slides. So, well, this won't be the final quality and safety survey, but well, this is an example, and we can work into it in our group and set it up for as soon as possible. In fact, as talked in our last meeting, in our case, we have already collected some of those data. So we will also work on the data from 2019, and we will launch the survey, and well, and we will put it forward. So just to finish, just a call to action. Well, I think that our colleagues must know that the official monitoring of an assessment of the networks has been launched from this month, January 2019, that in our case, from some specific indicators, but from the core indicators, 2017 and 2019 data must be collected, either from the information that the coordination centers have from the CPMS on what the healthcare providers can provide us, and we have since the end of February of this year to collect them. So that's a goal that we have to accomplish. And of course, as previously, when you see this webinar, just try to identify which people in your hospital can be needed in order to provide that data. And we will work in the following weeks to modify the quality and safety survey to fulfill not only our specific selected outcomes indicators, but also the core indicators that the European Commission has set last November. So,
how do you think,
yes, please.
How do you think that the collection of the data will be made? I mean, will there be a letter from the coordinating center to all the participants to gather this data, or how will you sort of go?
I guess we were thinking about using the expected. I mean, the way that we talk about the same way that we were going to distribute the quality and safety survey.
Yes.
So it will be an online survey with only those. I mean, not of course as many options that we need in order to fill this data, but it will be online. We will ask for information to all the hospitals that, as we mentioned in the board in Brussels, we will. I mean, we can personally talk to our colleagues participating in the quality and safety working group to focus on that.
But this survey, the invitation to go in online and fill in this data will be sent to the center coordinator, I guess.
Yes, that's the idea. Yeah, I don't know if you think we can do something else.
No, I think that's the way to do it.
Perfect. Yes, I mean the difference from we have expected last year is that we have now a specific data and a specific goal. Of course, I mean if we will have to do it more frequently than we thought about it, because at least annually and maybe in closer periods of time, if the European Commission asks for the indicators information in the expected, in the planned 3 months.
Yes.
And I guess that we will have to work. I mean, we will have to start working and then see how we can push forward this objective, because as we have talked in this working group, we have to be able to collect data in order to know where we are. If we don't know where we are, then we won't be able to know where we want to do, where we're going to go. No, so that
and also start to collect it right away, because February 28th, that's quite soon.
That's right. The idea was, after this webinar, to send to the group the modified survey, so you can all take a look at it, and we will have to use the month of February to collect the data. And of course, if some hospital is not able to provide us all the data, then we will use the data that we already have. I mean, and we will keep moving forward and giving feedback, and we will have, of course, the chance to see those results in our working group. I think that's the right spot to see how we are getting the data, and if there are some difficulties, that there will be for sure, in order to solve them and make it real, make it possible.
Yes.
So, don't know, Dr. Weber, if you have any question or something else that you want to bring up?
I don't have any questions. I'm just anxious to get along and to get started.
Of course.
And
Also,
the invitation to the center coordinators and the survey, maybe they have to be sent out in the next few weeks.
That's right. No, before the end of this month. That's the, I think, a good goal. Yeah.
Yes, I agree.
Well, so thank you very much, Dr. Brember, for joining the meeting. I also thank all the other colleagues that will take a look on this webinar, and I hope that it will be helpful to know where we are heading and how we can accomplish our goals as a network. So thank you very much.
Thank you very much, Jose.